Okay, it is, let me do the old knock in here. Okay, this is the Monday, September 17th Board of Health, Boulder County Board of Health meeting. And so one of the things we need to do is ask all of the participants to identify themselves for the record. I will start. I am the board president, Greg Thomas.
Board member Morgan McMillan.
Board member Landry Fagan.
Board member Brooke Harrison.
And Jeff Sayak, Boulder County Public Health Director. And I'm extremely pleased to introduce you to Lexi Nolan, who is our new Deputy Director for Boulder County Public Health. I want to turn it over to Lexi to just say hi to everybody so you can see Lexi, and maybe Lexi just give a short background on where you come from so board members know, but we're very excited to have Lexi on board.
Sure. Lexi Nolan. I have recently relocated to Boulder from Texas, which is where I was born and raised, although I've lived in a bunch of different places, and have experience working in policy and particularly in equity and social determinants of health, and really looking forward to working with you all.
Welcome.
Thank you.
Thank you.
All right, we'll keep going down the roster.
Yeah, please. Greg, do you want to just read it as you see it on your screen? That
Sure.
way
Yeah, that might be easier. So we have Rachel Arndt with Boulder County Public Health. We've got Tammy Golden. We've got Megan Hatton. We've got Joe Malinowski. We've got Rita Mangine and Lexi Nolan we just met. And then I think that's it.
Greg, this is Susan Motika, and I'm on the phone right now.
Susan's got the 9-1 number. Okay. Hi, Susan.
Hi.
Anybody else that wasn't mentioned? Okay. So we do have a quorum since we have 4 of our members here. This notice of the meeting was posted on the Boulder County or on the Board of Health website, and that call information was included to allow for public participation. Due to COVID-19 and the need for social distancing and the current public health order, this meeting is being conducted online and telephonically. Okay, now to the agenda. Okay, so first item is public comments. Do we have any public comments on unscheduled agenda items?
I don't know if there's a member of the public on, but I was approached, this is Landry Fagan. I was approached by directors of the sports stable who were asking what the process would be for potentially reevaluating their space and the capacity for social distancing in the stands, as opposed to being crowded in the bar. I mean, I know there's distancing requirements in the bar at the sports stable, but currently there are restrictions on the number of individuals who can be present in the sports table per sheet of ice. And it was just sort of a question that was posed as to what the reevaluation process would be for the space and if they could lay out other options for social distancing in the stands.
So Landry, this is Jeff, and what we would do is have them go through our process. So Elaine's not on the phone right now, but we would direct them.
I'm on, Jeff.
What's that?
I can.
I'm on, Jeff. I can help answer if you'd like.
Oh, great. Okay, thank you.
Yeah. So that particular facility has had some significant challenges already, but we'll certainly look if there's other components based on the safer at home orders, but we would not expect to be looking at variances or increasing anything beyond what the current state maximums are. And again, we've had difficulty in those operations there already. So we'd be very reluctant to do anything outside of what the orders are. But and we have been in very close contact with them. So if there's anybody that reaches out, feel free to direct them to our COVID business team. We'll happily continue to have that dialogue.
Okay. Is the who would be the person they would reach out to at the board?
You can have that sent to our COVID biz at bouldercounty.org.
Okay.
Gmail. Let me pull it up real quick.
So the directives are really coming from the state then, not the county.
We're enforcing all the state orders locally in Boulder County. We have not put any further restrictions on them beyond what the state has, but we certainly would not be looking at variances to relax any of those either.
Okay. I can pass that along at least. I think the impression from the person that approached me was that it was more restrictive than the state in Boulder County, and I couldn't speak to that.
Landry, the only thing that's more restrictive in Boulder County is our mask order.
Yeah. Okay.
And we can,
Okay.
if we can send you that link as well.
Okay.
Maybe if Lane could just forward you the email, that would be great. That way you have exactly where you can send them to.
Okay, that'd be great, and it'd be helpful to have the language just for communication.
Yeah, and I wasn't sure who I should send that to.
You can send it to me, Landry Fagan.
Landry.
Landry and at Gmail. It should be in there somewhere.
Okay. Thank you.
Thank you. Thanks. Okay.
Okay, thanks, Landry. So I'm not sure if we have any members of the public for just general public comment. It doesn't look like we do in Teams, but I don't know if there's a separate call-in line that I can't see. Well, I'm not hearing anybody, so I think we'll move on to agenda item 2, which is approval of the August 10th, 2020 regular meeting minutes.
I move to approve the August 10th minutes. This is Morgan.
Second, this is Landry.
Okay, not hearing any call outs, so all in favor? Aye.
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 Okay, item 2 carries. Item 3, public hearing on resolution 2020-02, adopting revised on-site wastewater treatment system or OWTS fees.
Good evening, this is Joe. I'm looking, is Erin Dodge on the call?
I don't see her.
Lane indicated he did not get the link, so I assume Erin perhaps did not get the link. I forwarded the link a few minutes ago, but I'm not seeing Erin either.
Joe, this is Rachel. I'll text Erin.
Should we skip in the order?
That might be a good idea.
Okay, let's Jeff or Tammy, I assume that's okay if we just change the order right now?
Yeah, that's not a problem.
Okay, all right, so what we will do is we will skip agenda item 3 and go to agenda item 4.
Oh, well, thank you. This is Lane Drager, Consumer Protection Coordinator. And we had come to the board earlier in the year to talk about our process where we had reached out to our body art community looking to update our regulations. And the big driver here was the National Environmental Health Association had been working on a model body art code, and they finally completed that. And so that was really the big driver for us to align our regulations with those national model code regulations. And so we, in your packet, have prepared the full regulation change proposal, as well as I think a summary chart of kind of highlighting where some of those changes are, and happy to answer any questions, because at this point we would be asking the board to move this to the public comment period and then look at final adoption at the next or future board meeting.
So this is Morgan. So Lane, you're looking for us just to recommend moving it towards public input officially? Is that, do you need a motion to support that?
Yeah, if there's any other concerns or issues, if these look like something, we would do that formal comment period. Again, we've already taken time to reach out to our body art community. I'm not sure if anybody within the body art community has potentially joined that if they would like to share anything, but yeah, at this time, then we would do that formal comment period and then look at adoption, barring any major comments that came during that period.
Hi, this is Tammy. So just want everyone to know that we have posted the proposed revised regulations on the body art website, as well as the summary chart that identified what the main changes are. And then, so now what we're asking the board to do would just be to schedule the public hearing for the October 12th Board of Health meeting.
Okay, thank you. This is Morgan. I move to schedule the public hearing then for October 12th for the body art updates.
Landry or Brooke, can you second?
Oh, second. This is Brooke.
Okay. And then I assume, Lane, that we'll just get some kind of brief overview presentation in advance of that public hearing, right?
Sure, I'm happy to highlight anything too. Let me know what will be helpful to you. If you want us to walk through each of the changes, we're happy to do that too. Or if you want me to highlight any feedback that we get, we obviously will do that at the hearing.
Okay.
But just let me know what the board would like to see.
Will do. Okay. So we have a motion and a second. All in favor? Aye.
Aye.
Okay. See you in October.
Thank you.
Okay. Now we're back to. All right. Are we still without Aaron?
Yeah, she's not on yet, so you may want to go to item 5.
Okay, then we will do that. Okay, moving on to item 5. It's resolution 2020-03, approving the 2021 recommended budget.
Hi everyone, this is Megan. I am just here to request approval for resolution 2020-03. Last month, Marielle presented the Board of Health at the Board of Health study session in regards to an $18,249,000 budget and authorized the staff to submit an additional $561,000 request for sustainability tax funding for 2021. This would be this is a recommended budget, so We will follow up with any adjustments from here until December in our December session for a final a budget approval for 2021.
Hey, Megan, this is Greg. So of the requests that did go for the sustainability tax funding, what input or feedback did you receive on that?
We believe almost all requests that had went in last year will be reapproved, and then we've had a couple additional FTE that we have added to it. Not full FTE, but some partial FTE to help cover some staff that would otherwise be funded by grant money.
Okay.
Any questions from the group that I can answer?
No, I didn't really have anything for follow-up after the budget study session. I thought it was all laid out pretty well. Clearly, the the financial challenges are huge. So yeah, there's not a ton of creativity that I think is necessary for this year, next year's budget.
I will add, just for awareness, that we did have an opportunity about 2 weeks ago to submit what the county had called an unmet needs request to help spend down some of their CARES funding that they received. And we submitted, I don't have it in front of me, but it's approximately about $700,000 in additional requests year spending. And so most of that has been approved. So we're working through the contracts at this point. So that will be an amendment that you'll see for our 2020 budget. And as of right now, all that money has to be spent by the end of this year, but it will help support us in some of the COVID work through like containment, mitigation, enforcement, and communication, as well as some of our testing efforts and trying to get some partner support in those areas. And through the end of the year, which will help extend some of our COVID funding from the ELC bucket through 2021. And so this is going to be a huge benefit to us that the county is going to support us in this area.
I just want to remind board members too that this year is the second year that we have a changed schedule. So just as a reminder, we will need you to have a quorum at our December meeting so we can finalize our budget in December. And then after we close the books in 2020, we will come to you with an amendment in early 2021 to adjust for whatever that book closing revenue or deficit looks like. So just a reminder again that we'll be coming back in December asking for final approval.
Okay, sounds good. So for right now, we just need to approve the resolution before us.
Yep.
Yes.
Any questions from the board members before we make a motion?
No questions. This is Morgan. I'm going to move to approve the 2021 recommended budget submission to the county commissioners.
This is Brooke. I second.
Okay.
Hi, this is me. We need to also, in addition to approving the resolution, we need to authorize the additional $561,104 request for sustainability tax funding.
Got it. Okay. So I will amend my motion. Thank you, Tammy, for keeping us on it. So this is Morgan. I amend my motion to say to approve the resolution 2020-03 and to authorize staff to submit an additional $561,104 request for sustainability tax funding.
This is Brooke, second.
Okay, all in favor?
Aye.
Aye.
Okay, motion carries. Thank you.
Thank you,
I
everyone.
see Aaron Dodge has joined us. So should we move back to item 3 on the agenda?
Yes.
Okay, so again, just to reiterate, item 3, public hearing on resolution 2020-02, adopting the revised on-site wastewater treatment system fees. Take it away, Aaron or Joe.
Great. This is Erin, the Water Quality Coordinator in Environmental Health. Thank you all. I apologize for being late to the meeting. So as you remember, last month I came and presented on our how we were determining the rates and a little bit of our methodology. And so this is really just the formal approval. We did not change the fee from when I presented last, so we're asking for it to increase to the $1,593. That is including the $20 fee to the state. So that's up from the $1,023 that it currently is. And again, this is just for the major repair and the new construction permits. And the other thing you'll notice that changed is our hourly rate did go up from I believe it was 142 up to $155 per hour. So unless anybody has any questions, we just ask, our recommendation is that the board approves these fee changes.
So just so I'm clear, Aaron, this is Greg. So in the table that I'm looking at for the proposed fees, some of those have converted from hourly fees to a flat fee, correct?
Yeah, the only time we have used the hourly fee is during extensive consultation that is far outside the scope of what we include in any of the permit fees. So everything else is always just a flat fee.
Okay.
So Greg, we need to open and see if anyone from the public has any comments.
Okay. I can do that. And so let's see here. Okay, so we announced the meeting, public hearing. Does anybody wish to speak on this agenda item 3? Not hearing anybody out there. So is there any comments or questions from the other board members?
Then you would need to close the public hearing
Okay.
and then entertain.
So no comments. So we will close the public hearing and then ask for, can I hear a motion from the board?
Hi, this is Morgan, and I move to approve the new fee schedule.
It's resolution.
Landry, I second.
Okay, motion and seconded. All in favor? Aye.
Aye.
Okay, motion carries. Thank you, Aaron.
Thank you all so much.
Okay, now we are back on track. I did notice that Sheila Davis had joined since the start of the meeting. Welcome, Sheila.
Thank you.
Okay, and now we are on to everybody's favorite board agenda item, item 6, update on current COVID-19 pandemic.
Well, hi, board members, and we're well ahead of schedule tonight for the first time in a while. So I promise I won't belabor us for a ton of time, but I am going to focus my update tonight specifically on what our most recent numbers look like in terms of the high-level indicators that we're tracking that would relate directly to protect our neighbor, as well as our surge metrics. And then I want to spend some time to talk about the University of Colorado, because I'm sure that's what's on most all of your minds. It's certainly what's on our minds at this point. And I asked Rachel, who is our liaison to CU, to attend the meeting too, because there's a ton of work that's happening. And I want to make sure that we can represent it and answer any questions you might have on it. So I'm going to share my screen. Bear with me for a second. You should be able to see it now.
Yes, we do.
Great, thanks, Greg. All right, so why is it telling me that? Let me open it up as a PowerPoint. Sorry about that. I don't know why it's not happy with that, but it's not. Hold on. It's just going to take me a second. Oh, it's really unhappy. All right. What I think I'm going to do, and I'm going to ask Rachel to help me here for a second, because I'm going to reverse order. I'm going to ask Rachel to talk a bit about what we're doing with CU, and I have to get access to my G drive, which it's not letting me do because it timed out on me. And then I'm going to put this presentation back up and go through it. So do we want to, Rachel, do you want to start and just talk about, I'm sorry again that happened. But Rachel, if you want to just talk about some of the work that we're doing with CU at a high level, so folks know all the 3 areas that we're focusing on, what the meetings that are coming up tomorrow are about, and how we are thinking about moving forward in terms of trying to get a handle on some of the spread at CU, and then I can go backwards into the data.
Yeah, I'm actually going to share my my screen for my CAN report today, although I'm very embarrassed by how many tabs I have open on my screen, so no one judge me. Okay, let me see if I can get it. Okay, as you can see, there's about 30 tabs. Just as just a high level update, and Jeff is going to share more on the numbers, we've really seen a pretty significant increase in cases at CU starting the middle to the end of last week and continuing through the weekend. The numbers that Jeff is going to show actually aren't completely complete. A lot of the cases have not yet been entered into CEDARS, so we're still waiting. The latest that we have, which Jeff may have an updated number, is that there have been 454 cases at CU. Our highest case number, I believe, was Friday with over 90, and we're still waiting on additional cases to be added. This weekend we did.
Sorry to interrupt you, Rachel. Can I ask for a clarification on those numbers? Because I am still a camera reader, and it's very unclear when they report the numbers, at least through the camera, what the difference is between the CU numbers and community numbers. And so, Jeff, I know you sent out communication over the weekend, sort of giving the heads up that there was going to be a high rate coming out, and Rachel, you're now discussing the high rates, but it seems when you read the camera that those are all non-CU numbers, they're community numbers. So can you just clarify that for a minute?
Yeah, so Jeff, please weigh in. So CU has their own dashboard. One of the areas of confusion that we were seeing over the last week is that CU was reporting their numbers on their dashboard before entering them into CEDARS, Cedars. So we've asked for CU to not report on numbers unless they have entered them into the state database. I believe that Emily will be working on breaking our dashboard out by CU versus community, but we're seeing that a majority of the cases are coming from CU. Jeff, I don't have the presentation with the actual numbers, but does that align with the presentation that you're about to give as well? Jeff? Oh.
Rachel, he's not on for right now.
Oh, okay. Maybe he's logging back in. Does that?
Okay, so thanks, Rachel. So it sounds like when the camera is reporting, 88 new cases or 90 plus new cases, those are primarily CU students, is what you're saying.
Yes.
Okay, thank you for that clarification.
Mm-hmm. No problem.
And this is Brooke, one other quick clarification. The cases that go into Cedars, those are confirmed cases, correct?
Yes. Okay. Those are cases confirmed by validated PCR testing.
Thanks.
So they're not the saliva tests. So just to provide a little bit more situational awareness around testing, CU currently is doing surveillance testing via a saliva test, and that test is not yet validated. They're working on getting that test validated. In the meantime, if somebody screens as positive via the saliva test, they are being referred for the PCR testing, the nasal testing to Wardenburg. So the university has a much higher capacity for the saliva-based testing and analysis. So that's why they're working to get that validated so they can use that tool. Okay, sorry, I'm going back to my notes. So for our actions this week, over the weekend, we did meet the city of representatives from the city of Boulder, the university, and BCPH to talk about these increasing numbers and to start strategizing. As a result, the multi-jurisdictional teams are meeting within containment, prevention, and enforcement. So the containment and the enforcement meetings have already happened, the first set of those. And the groups are setting kind of 2-day, 1 week, and 2-week goals around prevention, containment, and enforcement. That includes CDPHE partnering with us to set up, and Jeff probably has the most recent update on this, additional testing on campus for community and students, both on campus and off campus students. Let's see. So that's one of the last bullets on our actions. Sorry, I'm a little burnout from today. One of the other challenges that we're seeing and that we can't quite pinpoint is the exact source of the spread of COVID. So we don't know whether or not this is from folks attending parties during the day or at night, which will really impact our ability to do enforcement. We know that students are attending parties in groups of 10, and then that group of 10 is hopping to another party. So we're not seeing as many of the large gatherings anymore, as much as the smaller gatherings that are a little bit harder to pinpoint and enforce. One of the other challenges that we are experiencing, which we're hoping to get a handle on by increasing testing on campus, is that if out-of-state students get a test at a provider that is not Wardenburg, then their results are being sent to their home state. There's not a requirement for private labs to collect that local address. So we're hoping to develop an intake process that would send those results to Wardenburg as well as that home state. Another issue that we've uncovered in our work with Greek housing is that several Greek housing chapters are requiring COVID positive residents to isolate out of the house. It's a policy from their national chapter. In response to that, we have developed letters to that have already been sent out to local chapter presidents as well as their alumni advisors to let them know that would be they would be forcing their residents to violate public health stay-at-home orders by requiring them to leave. So still working proactively with some of these Greek facilities. The letter has worked as intended for some that are kind of happy to have that ammunition, and then others are doubling down. So we're trying to work with the university proactively on that enforcement, as well as sending the letters to the national chapter out in partnership with the Attorney General's office. Our EPIs are working on finalizing classroom and collegiate group housing guidance this week. I believe that the collegiate group housing guidance is final, and there will be a webinar Wednesday night from 6 to 8 with several of the Greek facilities. Last week, Carol, Lane, Trina, one of our county attorneys, and myself met with the unaffiliated fraternities on campus to share that draft guidance as well as answer any of their questions regarding enforcement and any other questions that they had about COVID. That meeting went pretty well. And then again, on the enforcement front, we're working in partnership with CU and the city of Boulder on an MOU to share addresses, as it's really challenging for public health to get the addresses and names of students that violate public health order for our enforcement. So working on that data sharing agreement with the university. And then also our EPIs are working to update their MOU regarding data sharing with the registrar, just to make sure that PHI is protected for students that test positive with COVID. We are working, and CDPHE is supportive of creating a dial or matrix for stay at home, safer at home, and protect your neighbor that we can use specifically for CU, so that we can take stronger enforcement actions with the university population. We're looking at, geographically specific potential orders, which Jeff can talk a little bit about, but nothing is final. These are just ideas we've seen from across the country. I'm just seeing if there's anything else that's super pertinent for tonight's conversation. I think I'll stop there and see if Jeff has joined us for the numbers presentation.
Yeah, I have. I'm going to turn off my video, and I apologize for that. Thank you, Rachel, for carrying us through that. And
Sure.
I will, let's try to share this again. Should work. My computer was very, very unhappy for some reason. Yep, we should be good now. Okay, so can everybody see those or not?
I can see it.
Excellent. All right. So let me just walk you through the, obviously this graph I've showed you each week, and it's been very different each week that I've showed this to you. And obviously we are that red line at the bottom that is trending straight up right now, and that is being driven by CU. So we definitely are seeing obviously an active outbreak. The majority of the outbreaks that we're seeing are coming from off campus versus on campus. There was some cases that were identified that you probably saw referenced in the paper. They were detecting some indications through wastewater that there might be more COVID positives, and that testing that was done in the dorms actually paid off. So that was a positive example of how that wastewater testing could be used as sentinel surveillance. But we are seeing a pretty significant jump. We are obviously the highest now that we've been in the entire response. We're the highest in the metro area. This is our daily counts, and you can see that we were up above up to 95 on this day, so pretty high case counts at this point. Luckily, we do have established the contact tracing and case investigations with the University of Colorado, but we are obviously having to also refer cases to CDPHE at this point with this many cases. There is a pretty significant increase in students specifically over the last week, as you can see in this graph. I've got a few more statistics here to show you at the end when I get to that slide. This is our 5-day case count that just smooths it out a little bit more, but you can see our highest peaks during these two previous outbreaks, nowhere near where we're at this point. And I think this has taken us a bit by surprise because we have done so much work on the front end with the university and with the city of Boulder. I don't think any of us expected that we would see such high case counts as we're seeing now. We were hoping, I guess, that the work that we had done on the front end was going to pay off a little bit more, but we clearly need to make adjustments because it's not working the way that we want it to. This is our patients hospitalized. So our hospitalizations are still looking pretty stable. We've got a little bit of a tick up here, and this is actually pretty consistent with the data that I've been showing you in the past. If you remember when I was here last month, I showed you where the case counts were coming from. The majority are still in those youngest populations between 17 to 30 years old, basically, is where we're seeing our largest case counts. And in that age group, we're not seeing as many hospitalizations. That's consistent with what we see at the state level as well. Even though there's high case counts in that age, we're not seeing associated hospitalizations with that age group.
Hey, Jeff.
Yeah, go ahead.
This is Morgan. Quick question. That reflects patients currently hospitalized, so that if you have a patient who's in the hospital for, let's say, 2 weeks, they would be reflected over multiple data points on that graph, or am I interpreting that correctly?
Actually, it should only be a single data point, but I'll defer to make sure that that's accurate. I don't know if Rachel or if there's anyone else on the phone that knows that for sure.
I am not actually sure. We can ask Andrea that question. I think she would be the best. Or Megan. I don't know if Megan's still on and she remembers from the past.
Well,
I can
anyway,
email you, Morgan, and also Andrea.
Okay, super. Thank you. Just wondering if it's that we have that many people per incident there that are in the hospital, or if it's like could be the same person that's there for multiple days represented by that count.
I'm almost positive, Morgan, that it is. These are all individual patients per day, so it shouldn't be represented over, but we'll validate that for you.
Thank you.
Mm-hmm. And then our number for rate of hospitalizations when I presented last time was down in the 50s, so we have bumped up a little bit, still significantly less than the state, significantly less than the national level. So hospitalizations are still looking okay. This is our percent positivity, and this is one that we don't want to see increase. The state level that they've been talking about, although it's a little bit different in the matrix that they have out there now, but our target has always been 5% or less. And we are ticking up a little bit. We've been doing pretty well, especially in this phase here where we were actually below 2 for a number of times, but we are moving back up. And it's about, when I was presenting to City Council last week, it's about 1% higher this week than it was at that point last week. So we do want to keep an eye on that. And that is going to be directly associated, obviously, with the number of cases that we see at CU as we move forward. And then I know Rachel probably talked a bit about these things, but our outbreak with CU is the main challenge. If we didn't have this outbreak, we would still be consistently low on that Metro graph that I showed you. So if you break out the total number of CU students, they're the majority of the students, are the majority of the cases that we're seeing, especially in the last week. 70s, 80, up to 90% of the cases that we're seeing are associated with students. And we know that this is a challenge to our K through 12 and private schools. So some private schools are already in session, have been, and they're doing well. And our K through 12 schools, we're wanting to go back with a mix of in-person and hybrid, starting at the end of September. So this will be a challenge, and we're meeting with them pretty frequently. It's averaging now once to twice a week, and we'll continue to do that as we move into the next week before it gets to the two main presentations that are the following week, which is the Boulder Valley School District Board of Education, as well as St. Vrain Valley School District has scheduled a presentation with all of their teachers for the evening of the 21st. And those were going to be the two areas where we really focused, and we're going to talk about moving to both hybrid for St. Vrain and some in-person and hybrid for Boulder County, or for Boulder Valley. And then Rachel, I'm sure, talked about the plan moving forward, the prevention, containment, and enforcement work group strategies that were there. We are having a meeting tomorrow morning between the University of Colorado, the City of Boulder, the State Health Department, and us to talk about public health order options. We are talking about things that range from something similar to what Michigan State University did with a recommended quarantine of all students for a total of 14-day period, so that we can try to get a handle on what's happening, to more prescriptive and identify detailed orders that would be geographically placed. But I think I heard Rachel saying when I got on the phone at the end there that one of the challenges associated with that is that it's hard to get really good case data at this point. We've got a lot of cases and contacts still under investigation, and it's going to be really difficult to have really good data to help us inform that. We also know that there's going to be more cases coming, so there is a backlog of cases right now from the University of Colorado that are not yet entered, so we expect to see some more of those in the next few days as those cases get entered. So just to give you a sense of how many cases we have, since August 17th, which is roughly a month from this point, we've had 717 new cases. 63% of those across that time period were students. And again, if you look in the last week to week and a half, the percentage that were students are much, much higher, 80s, 90s, and high 70s. And then our 5-day rolling average, which is one of the measures for how well we're doing in terms of protect our neighbor, as well as our 14-day case rate, have more than doubled. The case rate for the last 14 days per 100,000 has gone from literally in the 30s last week to then the 60s, and now to 171.4 per 100,000. So that's an 80.5% increase in a 2-week period of time. And it's a pretty big challenge for us as we move into the weeks ahead. The other thing that's a pretty dramatic change is when we look at our 15 to 19-year-olds and the case rate, that this is sort of the school age case rate that we look at. And it's because the majority of these are at the upper band of that 19-year-old category. We have seen a 950% increase since 2 weeks ago. So these are pretty dramatic numbers. We're working pretty diligently with the university and with the city of Boulder. When we're talking off-campus cases, the challenge is that we have to have strong cooperation from the city of Boulder, because when it's off campus, the city of Boulder has a strong lead in the enforcement. And when it's on campus, the university has a strong lead in enforcement. But regardless, there needs to be close coordination and collaboration between the university, the city of Boulder, and BCPH for all those areas, because if we're gonna hold students accountable to the behavior, then it takes the transition from off campus to on campus and looking at how the students get held accountable under the ethics violations that CU has as well. So there's a lot of work that's happening. I think what you will see in the next week, there's a whole host of strategies that I know Rachel I'm sure has talked about with you that we'll be implementing. Those are going to be paired with some type of order that would go forward in that same time period so we can try to get a handle on it. And some of the questions that we get for just so as board members, if you get these questions, you also know what our framework is when we look at this, is people will say, well, why don't you just close down the campus completely? And it's actually, our challenge is more so off campus with students than it is on campus with students. And closing down the campus won't solve the problem for us. We have students who are living in the community. They've already paid for their rents for the year, and most of them would not leave. We would still have to deal with the issue of off-campus spread of this disease. So it is going to take more effort of us to be doing education outreach as well as enforcement outreach and support as we move forward.
So Jeff, great.
Yeah.
So I think you just answered this question, but when you say on campus versus off campus, it's not necessarily a matter of where they reside. It's activities that happen on campus or off campus that you think are contributing to those increased cases. Is that right?
That is correct. So you have students who are on campus that will go to off-campus parties as an example. And you also have students that are off campus and will be partying. And what we're hearing from, at least from our EPIs at this point, is that there is some party hopping that's happening. So there is groups of kids that are in smaller groups, but they're hopping from one party to the next. And that's been challenging. There's not necessarily, and I would ask Lane or Rachel to validate this, but what I heard on our call today is that it's not necessarily that there's gigantic parties anymore, but there was rush activities that contributed to this. There is this party hopping and smaller groups that go from one party to the next that contribute to this. And those are some of the things that we really need to get a handle on. Lane, do you have anything, or Rachel, do you have anything to add to anything I said there?
I think that's accurate, Jeff. Greg, I'll just add that there are significant differences in the resources available to on-campus students. Those are students living in residential dorms versus students that are off-campus living either in Greek housing, apartments, rented houses. The students that live on campus and that are diagnosed with COVID and unable to safely isolate in their dorm rooms, there is space available that CU has set aside, isolation wards really, for students that are sick, and that includes food delivery to those students. The same thing is not available to students that are off campus, and so that has been a significant challenge that we're aware of, and that there just aren't as many resources to successfully address. And as we're looking at where to spend our community resources, it's a really big equity question. Do we want to be investing resources for CU students that we may want to be investing for some of the groups in the vulnerable populations document that was prepared by Indira and others at CDPHE. So just wanted to kind of throw that out there in terms of some of the challenges that we are investigating. I don't know if Lane is still on.
Yeah, I don't see
him.
Well, I'll stop there and see. And Rachel, did you talk at all about the potential testing?
I did talk about the potential addition of the CDPHE testing. I talked about the surveillance saliva testing that's happening and CU's interest in getting that validated so that they can use that for diagnostics. But right now, students that test positive via the saliva testing are referred for the full PCR testing that is validated at Wardenburg.
Great, thank you.
Yeah. I can't remember if I mentioned this or not, but if CDPHE does set up additional testing on campus. That would be for community members that are symptomatic, and then asymptomatic and symptomatic students, and with a primary focus of off-campus student testing. At least that's my understanding right now. We have another meeting tomorrow morning to discuss that strategy further.
Any questions from?
Well, I mean, the only thought I was like thinking, well, okay, so why is September spiking higher than April and mid-June, which is when the, Memorial Day impacts were. And it got me thinking, well, because college wasn't in session in April and June. And, I mean, I know that it's late summer, not really fall yet, but I mean, I think we expect some changes with seasonality. It's just, yeah, I'm not sure what good options there are for colleges. I mean, because obviously CU Boulder is not alone in this observation of seeing more. So I don't know. I guess it's just worrying, but I get the challenges associated with just saying all in person or all online.
Yeah, I'll just add to that. It is worrying. I talked to Jill Hunsaker Ryan today, and so they were also seeing this, as you know, Greg, on the campuses around Denver. CSU is seeing this. I forwarded an article today to my Metro counterparts, which was from the Associated Press, looking at where has going back to college been successful, and almost 100% it was in small college campuses. So, Middlebury College, Vermont type things where there's a lot less students. And they had at the end of the article, they were talking about large campuses and said it's been really difficult. And unfortunately, most of these campuses haven't been able to effectively figure it out. We did talk today in our meeting with CU or our internal meeting, about trying to look and see if there is other research that we're missing somewhere. But it is a challenge for us, and we're just going to keep trying to make adjustments. And again, one of the things that makes it a little more difficult is not being able to get enough good case information about exactly how the spread is occurring. So that that's something that everybody's challenged with right now. We've been talking about across the metro, but it is a challenge and makes it harder, and there's a delay in getting the information as well.
So you're not necessarily seeing better information sharing from student who have COVID versus the general population, because I know that I think last time I saw our statistics, it was around 50% were of the contact tracing were giving good quality information, and the others were either not calling back or just not willing to share.
And I'll have to validate our number because I don't know that right offhand. What I did hear in the previous outbreak was that we had actually pretty good response levels, even though I know some folks were struggling with trying to get contact tracing folks to follow up with them. We were doing okay with that the last time I heard, but I'll have to ask the question about, are we still struggling with trying to get information from people, or are they coming forward pretty readily? Unless Rachel, you know the answer to that.
I think that I can add just a little bit. I am hearing some reports from my colleagues at the City of Boulder that there's some reticence among CU students to fully share their contacts because they're concerned about enforcement from the university, like if they've attended parties and to identify the house where that party was located. So that is part of Carol and the EPI's communication to Greek housing that we're hoping to share widely on campus, that students won't be penalized at that point, especially in the contact tracing and case investigation, because our goal is really to stop the spread. So I do think that that's a legitimate concern, especially among group housing sites where people don't want to get their friends or their housemates in trouble. Yeah. Are there other questions that there's a lot, I'm sure, that Jeff and I didn't cover really into the nuanced details. One additional update that might be helpful that has been a bit of a barrier is that CU is updating their code of conduct so that it would be a violation not only to for students to violate a public health order, but any written guidance coming from public health. So this will just allow us to be a little bit more nimble and to ensure that students are also following quarantine requirements and not just isolation requirements as well.
With the spike over the last week or two, primarily in CU students, is there any idea when we would start to see how much of an impact this might have in the general population and maybe start to increase those hospitalization numbers based on previous spikes?
So in terms of the previous spikes, we actually did not see any impacts associated with hospitalization. And that was primarily, as I understand it, two reasons. Again, this younger population is not being hospitalized themselves, but we were able to effectively control the spread of the previous spikes or the previous one spike that we had with the University Hill outbreak that was in the middle of the summer. So there was not a lot of off-campus spread that we assessed that occurred during that process. And again, right now, and I heard Rachel report on this today, so maybe I'll defer this to her in terms of what that looks like with what we know with these cases right now, but we still have a lot of contact tracing that's still not done yet, so I don't think we can fully assess it yet.
Yeah, that's a good question. I think that the answer is that we don't know yet, and that we are starting to track, especially geographically, just where the increase in cases are. So we do have a map by block group, and I'm asking our GIS department to give me more of a time sequenced map so that we can really see where the concentration in cases are, and if that is spreading outside of campus specifically. So we will have that data to look at. And I think just even being able to differentiate the numbers between CU and the rest of the community, and if we're seeing a big increase in those cases and having the dials separated, will also help us track community spread as well. So if we're keeping cases contained within the university at this point, I think that would be the ideal scenario. So that's kind of the goal of that double tracking system for CU and then Boulder County outside of CU,
So,
as well as the geographic mapping. Is that helpful?
Yes.
That would be great.
This is Morgan, just as a follow-up question. So are most of these cases being found through routine testing and not necessarily that students are showing symptoms? I guess, do we know what the breakdown is? I mean, they're mostly being caught because of just routine testing, not because they're showing symptoms. Is that? Yeah.
I have, I don't know like the specificity that I can share, but I can say that almost all of the students are symptomatic. So they may have not thought that it was a COVID symptom. They may have thought that it was allergies or a really bad cold or flu. So there is going to be some improved communication, but the number of students that do test positive that are actually asymptomatic is really low, way lower than we thought that we would see. And we are starting to see students experience shortness of breath, which did not happen in the summer with the spike around the 4th of July. So the the health impacts seem to be a bit more severe, and it's probably a result of many more people becoming sick. But I can ask CU if we can share that specific data with you all. I think that we probably can, but I'll send that to Tammy to include if we're allowed to share that.
Hey,
Thanks,
Brooke,
Rachel.
Yeah.
as a follow-up to your question earlier, I was trying to find it, but I can't find it. I believe the average time to hospitalization after somebody has symptoms is around 14 days. We also meet with our hospitals on a weekly basis. So in addition to those indicators that we track with the hospitals, we're also doing weekly meetings with them as well. So we're tracking, plus we're trying to validate what we're seeing on the tracking. And again, I believe it's about 14 days is the average time to hospitalization if somebody's going to be hospitalized.
Got it. Thank you.
So Jeff, if that, if this week looks similar to the end of last week, and I know I saw the invite from St. Rain for next Monday. I mean, so what does that mean? I mean, a lot of schools are open, elementary and high school, right? There are examples in the state. And I mean, is it just a matter of the activities and the scale of the the interaction, that because it doesn't seem like we've heard much news on the elementary and high school side yet.
Yeah, it's so the data, so let me answer that a couple different ways. The first one is we have been looking at from a spread perspective from schools that are open already. We have been looking at data from Cherry Creek schools, Littleton, a few others. That data is being compiled and it's being looked at from the perspective of who are the positive kids in the schools. Did they have any secondary spread associated with the isolation and quarantine, which is really the challenge for the schools staying in place? I'll talk about that in just a second. And there's still very low spread, almost zero secondary spread associated with the quarantines that have occurred. And in terms of how what we're seeing impacts our schools, the challenge for us is not completely knowing yet if we are going to see generalized community spread. So if I just use the example of the CU outbreak in the summertime, we had that outbreak contained to the point where there was not other community generalized spread occurring that we were seeing being transferred to other people that was then causing hospitalizations to go up, as an example. We are not yet seeing indications of any kind of significant community generalized spread at this point, but we don't know because we still have a lot of cases out there if that will occur or not. So that's really the biggest challenge. If these kids are not in the middle of the community in Walmarts and in restaurants with teachers and other families, then there's going to be less likelihood of any kind of generalized spread. And that's really what drives the question for the schools. And if there is increased risk or if the risk is low enough to continue moving forward with the schools themselves.
What a crappy time to be a young adult.
Yep. Yeah, this is really difficult for everyone at this point.
Hi all. I just got text confirmation from one of the vice chancellors that I can share that symptom slide. So I will go ahead and Tammy, should I share that with you to communicate out with everybody?
Yeah, that'd be great. Thanks, Rachel.
Okay. So it's 7% to 8% of those that test positive that are asymptomatic. And it'll be broken down by total percentage of folks reporting each of the symptoms. So I will make sure that gets to you tonight.
Thanks for that follow-up, Rachel.
No problem.
So 7 to 8% of the positive tests, only 7 to 8% are asymptomatic?
Yes, but the students may not have sought out a test because of their symptoms. They may have still been caught during the surveillance testing, but they didn't perceive the symptoms that they had as being COVID symptoms.
Okay, all right.
So that is still, I don't know the data of who from, anyone that tests positive from surveillance testing is referred for the full PCR testing. And I would have to maybe dig into those numbers a little bit to see exactly how many students are only going to Wardenburg for a PCR test. And I think those numbers will be changed with CDPHE setting up their testing site as well. So I'm not sure we may ever have a fully accurate count of why someone sought a test, if that makes sense.
Yeah, no, I mean, and clearly goes against the notion if you're, oh, everybody's asymptomatic, nothing to worry about. They're just testing positive. So yeah, that's pretty stark. Any other questions, comments from board members? Okay, well, thanks, team. That was pretty informative and sobering.
No problem.
Thank you.
So it looks like we are on to item 7, which is the director's report. I know we've run short on previous meetings, so it would be worth probably just seeing if anybody has any questions about, especially about any non-COVID related activities that the department is still doing. And, I just want to give a shout out to all the staff. I know I'm, speaking from experience here, but we're 6 months into this pandemic, and while it has ebbed and flowed, and while the expectations have been that fall and winter will produce that second wave, it's still very, it can be very difficult to, manage the uncertainty associated with this outbreak and how that impacts our regular work. So I would just say, I know that the county always does a really good job of providing those resources for people who are struggling. And as we move from late summer into fall and winter, that's something that I'm concerned about. And so great job, everybody. Keep doing what you're doing. And, Jeff and the leadership team, I know you guys will be as supportive as you can be throughout this. I did have one question on director's report. Let me call it up here. So yeah, this came up in my shop as well recently, but the state, I know it's under the food safety bullets. The state inquired why public health isn't doing regular inspection work. And clearly, obviously, a lot of public health staff everywhere have been redeployed for COVID-19 response, and so we basically can handle like high priority complaints, but I was surprised that they're asking why we're not doing regular inspections. I think they would know the answer to that question.
Yeah, Joe, do you want to take that?
This is Joe Malinowski. I actually had brought that question up several months ago, just wondering, knowing how our food safety fees are basically collected from our license fees. And we can only use those for actual food safety work and doing inspections. And we have an agreement with the state that requires we do a certain number of inspections a year. And obviously, I'm thinking like Boulder County, most local public health departments aren't able to meet that because their staff has been deployed to COVID. I think we do continue to do plan reviews and definitely complaints and get facilities reopened and that kind of thing. But we aren't really doing regular inspections because our staff have been pulled away for COVID. And it is the priority. It makes sense.
And I know we still do work, and agencies do work with the regulated facilities. It just may be on the public health order enforcement and not on the kind of routine inspections that we are, used to doing. So it just one activity kind of supplants another, and there's only a limited number of staff to be able to do.
I think the challenge is communicating that to the Restaurant Association, and so they're aware of exactly what those staff are doing. Because you're right, we are still really involved with restaurants, along with a lot of the other businesses, with our for recovering for COVID and just responding.
Hey, Greg, is it okay if I open it up for a second to Megan Hatton and to Susan to see if they have anything they want to call attention to relative to the director's report?
Absolutely.
Megan or Susan?
This is Susan, and I wanted to call to your attention just the persistent, thoughtful work done by our health planning and evaluation team, the level of surveillance that's needed right now, as you heard from the, very serious critical reports from Jeff and Rachel. But the nimbleness and trying to meet the needs and trying to examine what other data is needed, how else can the data story be told, and also a commitment to looking at the aspects of equity in data and who is being really hurt by this pandemic. So just a shout out to that health planning and evaluation team.
Megan, anything from you, or are you good?
Sorry about that. I don't have anything to add at this time.
All right. Well, the only other thing I'll point out to the board is that you saw my email relative to the racial equity and the fact that we have, or structural racism, sorry, and the fact that we have the opportunity to do something in combination with the Boulder County Commissioners. So we will be bringing that back to you in October. We're pretty excited about that, and we're excited about the opportunity to work more closely with the county as a whole on such an important issue that we know drives more of our overall health outcomes than many of the individual behaviors that we often are forced to focus on. So I just wanted to make sure you're aware that's going to be coming back, but we're pretty excited that it's a comprehensive approach in the county.
Okay. Any other questions from the board members?
No questions, just every time we meet, I feel like I want to voice my support for all the work you're doing and for the extended team at Public Health, and my appreciation for your commitment and grit and month after month getting through this. So thank you.
Thank you, Morgan.
Okay, well, moving on from the director's report, item 8 on the agenda, any old and new business? So I know Jeff introduced, well, I don't know, I'm not sure we got to introduce our new board member. Brooke, if you would like to say anything, just who you are and what your interests are, feel free to. Otherwise, we will look forward to meeting you in person. Well, I don't know when.
Hopefully someday soon. Yeah, I'm Brooke Harrison. I'm glad to be here. My PhD is in molecular biology, and then I did a postdoc in biochemistry, but all of my research was in infectious disease, but mostly parasites. So toxoplasma and then malaria, which we don't deal with a lot here, which is good, but who knows, with COVID, who knows what'll come next. But anyways, I'm glad to be here and I hope to meet you all in person soon.
Welcome
Thanks,
to the
Brooke.
board, Brooke.
Thank you.
We'll get you wrapped into an orientation as well, Brooke. So thank you for bearing with us.
No problem.
Safe travels back home, Brooke.
Thank you.
Any other items? Okay, everybody. Stay safe, stay healthy, and just keep doing all that good work that you're doing. And
Thanks, everyone.
That we are adjourned.
Okay, thank you.
Thank you.
Thank you.
Thanks.
Good night.
Thank you. Bye.
Bye.
Thank you, everyone.